RJ, synchronized, charging.
Why didn't they cut off her bra?
Let's intubate first.
Oh, because it's a TV show. Me getting into the medicine. Hi friends, welcome back to my channel. My name is Peter. I'm a real doctor and a real Disney fan. You might have seen me across YouTube. I initially reacted to The Good Doctor, Grey's Anatomy, Scrubs, and a bunch of medical shows, Cells at Work as well. My Cells at Work 2 reaction got striked, and so I'm dealing with YouTube on that end. But a lot of you said that I should react to Transplant, which is a brand new show on NBC. I have no idea what it is about, but the first episode is already launched on my computer, so we're going to be watching it together today. And as always, if you enjoy this channel, please consider supporting on Venmo. I have to pay for everything for this channel out of pocket. I just purchased a bunch of stuff for our live stream, so if you would like to support, I just became an MD this past April, so I still have a bunch of loans. I'm not one of those doctors. I'm one of those doctors, you know. You have my commitment to always create clean, comedic, and creative educational entertainment for you here on this channel that is safe for your whole family. So if you would like to support that, all my links are down below, as well as links to my Amazon products if you would like to start your own YouTube channel. The main reason I'm asking for support is my hard drive crashed recently, and it had a whole bunch of, it had everything on it. It was a 4 terabyte, and they're saying it could cost $2,500. That is $2,500 to repair, and I'm praying that they can do it. I'm turning to you all because I figured this is a community, and if this is something you would like to support, then why not? And if you cannot give monetarily, that's totally fine. All I ask is that you like the video, subscribe, share it with someone else, leave a comment in the discussions down below. I love reading your comments. I read every single one, and I enjoy our community. So let's get straight into episode 1, season 1 of Transplant. Enough talking! I've been so long since I did this. Enough talking, let's jump straight into it. Hey. This Hindi or Arabic? This is Arabic. Is he gonna become a surgeon because he's a butcher? Oh, Arabic rap?
We'll talk about this later.
What are you ordering? Alright, there's drug references. Children don't do drugs unless they're prescribed. Unless that was like a slab of meat. I like that we don't know what's happening.
Do you remember me, sir?
Oh, what an intro. Oh, what an intro. Oh, we're left hanging and dangling, wanting to know what the backstory was. Go! Dude. I'm totally okay with blood, but like, pulling out. Oh, did he get a glass in his eye? Oh my Jesus. Oh my Jesus. Oh my gosh, she's resetting her heart. Okay, let's pause right now, just so we can process. Oh yeah, we're supposed to be reacting. It's so funny. Also, the reason I do these reactions is because I am a real doctor, so I know the medical side, but I also studied acting and I am an actor, so I can give the film and the arts perspective. So, right off the bat, the drama is so well orchestrated that you're hooked into multiple layers of things. You want to know the drug deal that happened, or this potential drug deal. It looks like a drug deal. The reason he's working at the shop and he knows all these medical things. The interaction that he had with the elderly gentleman. Why the truck came through. So there's a bunch of things happen and you just feel suspended in the mystery of it. So that's really smart. It's a great way to start the show off. His uncle was bleeding behind his eye, so he cut, just like you saw, to release the pressure. The woman who was on the floor, she looked like she was pulseless. I don't know how he was able to tell. I didn't see if he was feeling around for her pulse or around her carotid artery to check. And then he punched her chest. I'm assuming that's a functional comparison to CPR. You're trying to functionally pump the heart. At the very least, you're getting oxygen to the brain. The American Cardiology Association did some studies and said the 2 breaths, if you are nervous about doing it, you just have to do the 30 compressions. That's what it looked like he was doing here by punching on her chest. I wonder if that's a different thing. Also, just so you know, because CPR can save anyone's life, I'm going to show you a brief demonstration. This is not supposed to take the place of actual training, but because any help is better than no help, you're going to take your non-dominant hand and then your dominant hand and put it behind it. And kind of like that, right? But you're not going to flatten. And you're going to put your palm on the sternum of the chest. Hi, how you doing? My head is cut off. And the reason I'm letting my head get cut off is because you want to stand over the body. Pretend this is the body. This is the person's head. It actually looks like a body, right? This is the person's head and this is the body. I would stand over the chest of the person who doesn't have a pulse, and you would have full elbow lock and push your weight onto the person. And the compressions are 30 compressions, 2 breaths, 30 compressions, 2 breaths. And if you're like, what's the speed I'm supposed to go? Great question. The actual song you're supposed to sing in your head, which is kind of ironic, is staying alive, ha, 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 staying alive, da, 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 staying alive. But of course, call 911. In case you are the first responder on scene, call 911. And try to do as much help as you can. If you're interested, go ahead and look it up on YouTube. There are a ton of videos. I think it should be something that is just in every high school. Every high schooler and above should be trained on basic life support. So it's kind of like that TikTok thing. I guess, yeah, it is. Oh my gosh, he's not gonna do brain surgery.
You have an epidural hematoma.
Let's talk about this before we see the gruesome scene, because I don't want you to have to see that, and also I don't think YouTube would allow me to put that on a kid's channel. So, neurosurgery. Okay, the purpose of what he's about to do right now is to relieve the pressure in the brain. The brain is such a perfect little box. You have brain tissue, you have cerebral spinal fluid, you have arteries, you have blood vessels, you have the skull, the container of the brain. Now, there's something called intracranial pressure. There is a normal pressure that exists inside the skull. Now, if you have an increase in any of the components that are inside the brain, inside the skull, tumor growth, where the cells are expanding too much, that is increase in brain tissue. If you have a burst blood vessel, which is what this person has, you're increasing the blood that's in there. And if you have a blockage at, like, what is it called? The foramen of Lushkovich or Magnashkovich or something. The names always escape me. Don't really matter, but you can have a blockage of getting the cerebral spinal fluid flushed out of the skull. When any of those components grows too much, it starts compressing the others, impacts your functionality. So it's a very dangerous thing. He's gonna now just drill a hole, I'm assuming, into the temporal lobe of his skull. The frontal lobe, the temporal lobe at the side, the parietal lobe, and then the occipital, which is in the back, and the occipital is what controls your vision, so it's kind of like a straight line through your head. If he doesn't drill a hole to have the blood leak out, you can start herniating the brain. The brain tissue starts pushing down on other stuff because the nerves that control vision go through the brain, and those are the most sensitive to brain tissue starting to get compressed downward. I think this is an uncle herniation. That's my prediction, but that's just fancy medical terminology. Let's see.
I'm not going to let you die here. I know what I'm doing.
Yo, his eyelashes are incredible. No, don't show it. Don't show it, don't show it. Oh, what is this rated? All the while he has glass in his abdomen. Alright, well, that's an intro. We spent 40 minutes talking and it's been Transplant. Created by Joseph K. I want to start my own medical show. I have a great idea. I'm actually writing one.
Unconscious with a GCS of 10, O2 sat 88%.
Briefly, GCS is Glasgow Coma Scale, Glasgow Coma Score. It is when someone has altered mental status. There's a kind of criteria, a rubric that we use to grade their mentation. It's graded from 3 to 15. Eye movement, verbal response, and motor response. Anyone who has a Glasgow Coma Score less than 8 needs to be intubated immediately.
29 years old.
Okay, so no, that needs to stay on. I'm Dr. LubDub.
Yo, everyone does that.
How many victims were there?
Dr. Jed Bishop, GCS 3, significant head injury with a blown pupil and skull fracture.
GCS 3? That means he scored the lowest on all the Glasgow Coma Score. So you learned something. We can apply it immediately. That's the education entertainment. Not that this is anything to be entertained. Well, it is. I mean, it's a okay, let's just not get into the philosophy of medical shows.
Okay, we need to intubate and get him to CT.
I got this.
They didn't intubate on the way from the ambulance?
Let's show Dr. Bishop he's prepared us for this.
Everyone's way too calm. Way too calm. This is a bit of the dramatization element, you know, the actors, the arts side. They are bringing them into a standard emergency room, and that's probably how you would see things too when you go to the emergency room. Like, everyone has their own bay. This is a trauma, and at least in my hospital, we had our own trauma bay, and everyone there was on their toes all the time. Stab wounds, gunshot wounds, everything, hit by a car. People were responding immediately, and there was like a well-oiled machine where nurses would put lines in and doctors would be doing physical exams, we'd be cutting the clothes off, we'd be calling chest x-ray, we'd be on standby. Everything was so well-oiled. This is dramatization, because they're just like, no one would come into a hospital with a Glasgow Coma score of 3 and everyone just be this chill about it, especially if it's their chief. I mean, not that it matters, but I mean, it shouldn't matter. I've been in many discussions where doctors inform the team that the patient that we're taking care of is a VIP patient, which means either they're a celebrity or they are someone who knows someone who works for the administration at the hospital. So when I hear that, I'm just like, every patient is a VIP patient. Unless we're not treating them that way, which becomes evident in, okay, let's, you know what I'm talking about. So sad. I'm a doctor. Oh, did he do medical school in another country and then he came here? He's transplanted? That's a very common story. Oh, snap.
That's ready?
Let's get
Yeah, see? Okay, this is how it should be.
200J, synchronized, charging.
Why didn't they cut off her bra?
Let's intubate first.
Oh, because it's a TV show. Me getting into the medicine. Who cares about the bra? Cut it off! I forgot we're on a TV show. Man, you saw me. I want to watch myself now, just how intensely I was watching this, because I completely forgot.
The patients at this hospital are not your concern, all right? I need you to wait.
Not yet. These lines are setting up.
Significant epidural hematoma and cerebral edema.
Yeah. Epidural hematoma. Oh my gosh, there's so much to talk about. There's a type of hematoma. There's epidural, subdural. So remember when I explained the spaces in the brain? I was like, the epidermis is the topmost layer. So epidural hematoma is above the dura layer, and there's blood in that space. And then you have subdural, which is below that. One is a crescent and one is a football. I believe epidural is football. Yeah. So epidural looks like a football, and then subdural looks like a crescent moon. You always second guess yourself just because the smallest mistake in your neuronic pathway of trying to remember these things. That's how I studied in medical school. I just had a whole bunch of memory tools and mnemonics. Speaking of which, this would be a great place to have our sponsor talk. This happens always so naturally. So in medical school, I've used a lot of memory tools and mnemonics. I call them my clowns in my head because the smallest thing can really throw you off during an exam. So I just had like like a bunch of clouds running around in my head. I'm just like, hey, I just need to know the difference between epidural and subdural. Epi is a football. And the other one's like, subdural's a mood. So, you know, just really silly things to help me remember. Our sponsor for this video is Osmosis. It's an online medical platform for medical students, nurses, PAs, anyone who wants to learn more about medicine. They have a YouTube channel with a bunch of videos that I've personally used for my medical school exams as well as for my national board exams. They are giving away 2 3-month subscriptions to anyone who signs up. So the link down below is in the description, as well as a free 7-day trial. So please go check them out. If you're interested in just learning about medicine in general, if you're not in medicine, you can just go type in, let's say, asthma, osmosis, and then just look at the videos that they have there. Great, quick animations about the physiology, the pathology, the diagnosis, and the treatment of a bunch of conditions, and I've personally used them. So thank you, Osmosis, and yeah, let's get back to the video.
Did he get out? I told them that he was in there, but...
No one would let a fully bleeding man walk. See, I told you.
Or maybe in shock, he was in a major accident.
You said he's Middle Eastern?
I love how she's standing up for him. Yes!
You gotta come with me.
What a silly setup. You gotta come with me. Too dramatic. That made me, that's just funny. Hello?
Managing my moderate to
Oh, it's a commercial. I was like, these actors look different. Anyone want pizza?
I know if a doctor told me I needed medical attention, I'd be sure to get it.
Oh, they're in Canada?
And a witness who doesn't cooperate is guilty of obstructing a peace officer.
Is that a real thing? Anyone who's in law?
The best doctor I know was there with her.
What's that woman's accent?
Hole with a power drill. For blind shot, that's right where.
What kind of... What? 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 Did you see how they wash their hands? Even Patrick knew how to do it better than that.
Don't touch me, I'm sterile!
They're just like... Maybe this is a good time to talk about hand washing. I'm gonna talk about it here, but I want to come out with a 1 to 2 minute video about how to actually wash your hands, especially because of coronavirus, how to wash it like a doctor, how we are trained to do it. When I first started medical school, I texted my mom and I was like, "Ma, there is a 23-minute video about how to wash your hands." And she's like, "You don't know how to wash your hands?" I was like, "I do." But then I watched the video and I was like, "I don't." You have to remember that your fingers have 4 surfaces. The sides are 2, and then the front and the back, the palmar and the dorsal. Some new movements that you can do is make a bear claw and scrape your palm with both hands. Another one is your thumb. So you put your thumb up like that and then you scrape up, your other thumb up and you scrape up. Another one is you use, kind of like we talked about before with the chest compressions, which you're not using your elbows, you're using your body. Hey. Scrape like that and make sure you get down to your wrists, hands on hands, clip, and then here too. What they just did was really poor form, especially because the final thing that you're doing, you just cleaned your hands, right? And in surgery, you clean all the way up to your elbow, your forearm at least. Up to the place that you scrubbed is clean, but then everything beyond that still has its natural bacteria. So when you clean, you put your hands like this and you go kind of like a scoop motion under the faucet so that the water comes down your hand and off your elbow. And then you do your next one kind of like that. And then you end up with your hands up like that so that all the water from the clean down to the dirty is dripping down this way. When you clean like this, the water is going to drip downward back from what was dirty onto what you just cleaned and just make what you cleaned dirty again. I know it's a very specific thing, but you'd think they would have trained them how to wash their hands. Also, go watch my video of my first time in the OR. It is one of my very first videos, and it was so funny because I was not taught how to scrub in before I went into my first OR case. I messed up 3 times, and I was just like, why did no one teach me this? It's great. You learn it by being yelled at. Medical education.
Do you think he's gonna make it?
Yes, good, no answer. Leave us wanting more. I feel we know the least about this guy, and he's been most on screen, and that's really smart.
Precordial thump, I've never seen it work before.
Precordial thump.
How's your patient?
Critical.
Are you allowed to say this in Canada? In America you can't, that's HIPAA violation.
You still need stitches, don't move.
No. She would not abandon him mid-procedure like that. You don't leave a patient mid-suture. So this is kind of confusing because they were just considering going into the neurosurgery suite. But if they were able to go, then maybe their surgery residents doing a rotation in the ER or their trauma surgery residents. But then they wouldn't be responding to kids who are vomiting. Like Grey's Anatomy, they're surgeons. In Scrubs, they were just internal medicine residents, or JD is his roommate, Tucker. Chris Tucker, is that his name? Wow, if that's his name, A+ for me for pulling that out. It's a nice lamp. The small things make me happy.
Okay, she's got a large pericardial effusion. She needs the fluid out now.
Pericardial effusion, they need to suck it out with a pericardiocentesis. They're gonna go tap it and pull. She's assertive without... Hello? Hello? Yo, this homeboy's sprinting. I appreciate that commitment to acting.
Can I help you?
His daughter?
Because the trauma of the accident exacerbated an underlying condition.
She's so heartless.
There's still some tests that we can run before this item.
Yeah, you don't just jump to transplant. That's a bit too aggressive.
You think she needs a new heart? I'll sign.
Good acting. I like Mags. Is that her name? I can't tell if they're asking for magnesium or if that's her name.
Negative for hemochromatosis, sarcoidosis, and amyloidosis. No sign of infection, viral or...
Amyloidosis, sarcoidosis, but she says sarcoidosis, amyloidosis. Maybe that's how they pronounce them in Canada.
You can't leave me in this circus when your fellowship's over.
The roles are being more defined, which I'm liking. She is a resident, an emergency medicine resident. He is a fellow in emergency medicine, I'm assuming. And June is a surgery resident who I guess is just doing an elective in the emergency department.
Mr. Hamed cleared his airway.
He must be a doctor.
You still owe me last month's rent.
This week, I promise.
I feel everyone in every show always owes last month's rent. That's a good shot. Oh, he knows him because he applied. Aww.
Are you asking about a patient in this hospital?
Translation line? Hello? Good receptionist. God bless her heart. This girl's a good actress. I like the little twitch she's doing with her leg. It's a smart choice. It must be one of the scariest things to not only be sick, but to have to go to a hospital in a place where you don't speak the main language and you are not documented. I'm grateful for in my training that I worked at a hospital where we never cared about people's documentation, insurance status, any of that. And it was kind of the norm to always be on the translation line. I rotated at another hospital, which was a private hospital in an affluent white neighborhood. And there was one patient who needed a Spanish translator, and it kind of, you can see everyone grimace and sigh and drag their feet that they needed to call the translation line for this one patient. And I was like, what? I'm planning to come out with a video of just my top experiences I had in medical school. And one of them was, just as a little primer, as a teaser, I was on surgery, and usually the next morning after abdominal surgery, you're asking how they slept, and of course, if they're having any bowel movements, if they are passing any gas, any of that kind of stuff. So they asked the guy, did you pass any gas overnight? And he was just like, and they're like, did you make poo-poo? And he's like, because he doesn't speak English. And one of the residents like pushes us aside. He's like, I got this. And he goes to the foot of the bed and he looks at the patient. Bowel movement. And then he just walked out. And I was like, what is wrong with you people? Ugh. It drives me bonkers. Another time, I was in the OR and the nurse was making sure the patient was the right patient, asking them questions like they do routinely. Are you Mr. So-and-so? Are you here for a hernia repair? And he was just like, and she was like, are you so-and-so? Hernia? And he looks at me and I'm like, he doesn't speak English. And she's like, oh, okay. Hernia? Okay, good. Yeah, he's consented. And then we just continue with the surgery. And I was standing there like, as a student, you feel so powerless to stand up and advocate for people. They want you to advocate and at the same time shut your mouth, because if you speak up, everyone's gonna get mad at you for slowing the system down. And everyone knows it's a broken system, but no one works hard to change it. And even their own mentality of wanting to make the system different. Everyone's just so okay with the status quo. And that's why healthcare is a profit-based business, and it sucks in this country because people just ride the wave of abuse to the top and then they start abusing everyone under. To the point where I was talking with some of my friends about this in medical school before we graduated, and we were all down in the dumps one day and everyone's just kind of upset. Everyone has like $200,000 to $400,000 in loans at 7% interest, and it's abusive, and we're not sleeping, we're working really hard. Anyway, after all this stuff, I felt like there was a lull and a kind of gloom over the room, so I just shared, I was like, you know what, maybe it's time to be a little hopeful. And I said, hey everyone, I just want to remind us that yeah, it's really tough and it's difficult and it shouldn't be like this right now, but I want us to remember this and charge it so that when we get to a place when we can change it, we can make the system different for everyone who's coming after us. And without hesitation, this guy in my class bit my comment so quickly that it's just so ingrained in his personality at that point that he was just like, are you kidding? When I get to the top, the money's going to be going in my pocket. And everyone laughed and started like clapping for him. And I was like, it makes you feel so hopeless that no one wants it to be better. Everyone is so abused that the only out is to look forward to abusing others. So I can just imagine how terrified she is that she doesn't speak the language. She is a minor. She doesn't have documentation likely. It's just terrifying. As a doctor who speaks English, I still struggle with the medical system. It's like really convoluted. So I can't imagine how other people just attempt to go through it. It's purposefully broken, I'm convinced. She would be a good Tinkerbell. Assassin's Creed. I'm really liking the title of the show.
A phone? You said I couldn't have one.
Aww, it wasn't a drug. Look at me with my own preconceived notions.
Happy birthday.
Mr. Hammond.
The police officer. Ugh.
You should think about how you're gonna use it.
I like her. She's a good actress and a good personality, good character. Ooh, what a shot.
Already ready to grill us.
Well, good to know he still feels like himself.
Baby! Is there a pediatric television show? Would love that. Not even a sorry.
Before you leave,
But his suture.
one more doctor needs to
His
see.
suture. Thank you for saving my life. My name is Mr. Bishop. Would you like a position at this hospital? No residency required. Something like that.
Your daughter? My sister?
Sister.
Tell me a little about yourself.
Aw, smile. Bashir, that's his name. Alright, let's talk about it. Wow, that was really, really expert. The way the show starts off is one of the strongest beginnings, and I really enjoy that they provided a lot of suspense. The potential drug deal, which turned out to be the cell phone, the backstory between him and Jed, the truck coming through. The medicine in this show is very, very accurate. However, the subtle thing about it that is off, that feels a bit dramatized, is the context in which it's happening. Ambulance bring these people to the emergency department, they would be immediately treated, and there would be teams there ready that have been called in ahead of time, and everyone's ready to divide the labor and immediately treat the patients. This was sort of bringing them into an actual ER and then just triaging them there, bringing someone with a Glasgow coma score of 3 and then still decide what's the next thing that we're gonna do. That doesn't happen. I really like the acting in this. The characters seem like they are likable. The main character, Bashir, I feel was on screen so much, but was doing so many things on screen that we never got to see his processing, and perhaps that's how it's written so that we can maybe see him blossom and unfold in the following episodes. The final thing I'll say is I wish the show ended with them telling us what the job was. They use language here that's pretty, like, they dance around the facts. Like at the end of the show, they're like, let's have that interview for the job you wanted. And it leaves you again in that sort of what's the mystery of it, but I don't know why they didn't just say it at the end of the episode so that the full pilot, we get the full picture of where the show's gonna go. I don't know if he's applying to be a nurse, I don't know if he's applying to be a PA, a resident, or a physician, like an attending physician at the hospital. So that feels like it could have just easily just been a one-liner. Like, well, the reason I'd like to be a doctor is blank, and then it ends like that. I'm a big fan of the social complexities that the show is probably going to delve into more than it just did in this pilot, with undocumented, non-English speakers, the convolution of the medical system, assuming things about patients, standing up for patients, advocating for them. They were not doing a drug deal, it was a cell phone. So I like that because it puts a mirror to us to reflect on things that we hold and assumptions we would have had and the characters we see ourselves as in the show. Anyway, thank you all so much for recommending this to me. I loved this episode. I love your recommendations. Please continue to put them in the discussion down below. I want to hear your thoughts. What was your favorite moments? Anything else you'd like us to react to here on the channel? I read every single comment. If you enjoyed the video, please give it a like and subscribe. Share it with someone else who would be interested. It really helps the channel out. And if you can give monetarily, please check out our Venmo and our Patreon. And as always, be safe, be strong, be swagged. God bless you, and I will see you in the next video. You can check out some bloopers right now. Take care, bye! And some more videos. And wear your mask, please. Bye! Our little moon of reassurance. That not everything's okay. The link for the moon is down below in the prescription box. Get it? Cause it's a medical channel. Okay. Yeah. Okay. My name is Shelby. Okay. Bonus points if you know where that's from. Excuse you.
I know you told that police officer that you'd get him after we finished. But what if instead of that, you don't?
I'm sorry.
And be loved for who I